Helen.
Explanation. Last weekend, Corla, a letter from the Mental Health Commission to the HSE came into my possession. It was quite shocking. Firstly, because in it we learned for the first time that it was the intention of the Mental Health Commission to deregister the psychiatric unit in University Hospital Waterford, completely close it down. This is the psychiatric acute unit for the counties of Wexford and Waterford. What the new determination of the Mental Health Commission is to reduce the number of acute beds there from 14 to 6. I want to just give a brief background. In 2010, following the closure of St Senan's Hospital in Enniscorthy, in accordance with the Vision for Change, the acute psychiatric services for County Wexford, except for the very north of County Wexford, was added to the acute psychiatric services for Waterford and provided in Waterford. The 14-bedded unit has caused deep concerns over recent years as being inadequate. And indeed, when you read the letter from the Mental Health Commission, which basically says serious concerns remain as to the safety, health and well-being of residents in the approved centre, it is quite clear that the current unit is not fit for purpose. That may well be the case, but the notion right now that there would be only 6 acute beds available for the counties of Waterford and Wexford is wholly unacceptable. In a letter received by myself and I presume by other deputies yesterday, Minister McEntee, and I wish her a speedy recovery herself, indicated that an appeal would be lodged. But the appeal has to be determined by next Friday. If not, the unit will be reduced to 6 beds as and from next Wednesday. Now that is just unacceptable. So I would ask the Minister of State present to indicate in very clear terms what provision is going to be made for acute patients beyond next Wednesday, in the assumption that the ruling of the Mental Health Commission stands. And bluntly, the letter yesterday aggregated acute and subacute beds to talk about 36 beds. I'm focusing exclusively on the acute beds, which is to be reduced from 14 to 6, which is wholly unacceptable and would quite frankly cause consternation among all the population of Wexford and Waterford.
Well, on behalf of the Minister again, can I state it's unfortunate she can't be here due to taking suddenly ill last night. I believe she's home at present. That's the latest word I've got. She's been released from hospital. The Government is strongly committed to improving all aspects of mental health service since 2012. Around £140 million has been added to the SHE mental health budget, which now totals £851 million. With regard to provision of acute psychiatric care in counties Wexford and Waterford, the acute mental health in St Senan's Hospital in Enniscorthy, County Wexford, was amalgamated with the Wexford Mental Health Service in 2010. This now provides a 44-bed acute inpatient mental health unit under University Waterford. The Department of Psychiatric in the University Hospital Waterford provides an inpatient assessment, treatment and care for service users living in the Wexford area. Service users who live in North Wexford who attend the Tara House mental health services in Gorey and require acute inpatient admissions have access to the Newcastle Hospital, Greystones, County Wicklow. To ensure that each mental health facility is fit for purpose, the Mental Health Commission is charged with visiting and inspecting every appropriate mental health centre at least once a year. On February 3, 2017, the Mental Health Commission notified the HSE that the following number of inspections during 2016 is proposed that the Department of Psychiatric University Hospital would be registered as an approved centre with conditions. The primary among these conditions was the number of beds would be reduced. The HSE has until, as already stated by Deputy Howland, the HSE has until Friday of February to make the representation to the Commission to either modify or remove those proposed conditions, based on evidence that the Waterford is or will be completed with the regulations in which the proposed conditions relate. The HSE intends to request that the Commission does not, as a condition of registration, require the HSE to reduce the number of beds operating in Waterford under the Section 64 of the Mental Health Act 2001, the Commission can specify the maximum number of residents in an approved centre or within an area of approved centres. In this instance, this is proposed because, in the view of the inspectors, there is insufficient space for the total number of residents. There is a lack of dining, recreational and quiet spaces for residents. The provisional proposal programme of work, which would have addressed the above and these points together, pose a risk to service users' safety. The HSE will make recommendations to the Commission, or representation to the Commission before February 24th, detailing how the HSE intends to address the points above, including a revised programme of work associated with a timeline. The HSE will continue, however, on balance, a bed reduction is less safe for services users' population of the CH05 than maintaining the current bed base, with the control and improvement plan to be provided. Bearing in mind all the circumstances, I am confident that the HSE and Waterford will resolve this issue raised by the Commission. The Department will, however, continue to closely monitor the issue raised by the Mental Health Commission in conjunction with the HSE to ensure that the necessary corrective actions will take place.
Ireland, 1 minute.
I regret to say that the Minister has not given factual information to the House. In her statement, she says this now provides a 44-bed acute inpatient mental health unit in University Hospital, Waterford. That is not true. If you read the licensing authority of the Mental Health Commission, condition 1, the maximum number of residents which may be accommodated within the acute unit of the approved centre is 6 patients. There is a sub-acute unit of an additional 30. What I've tried to underscore is those with acute psychotic conditions need an acute bed in an acute unit. There are 14 now. As in from next Wednesday, there will only be 6. So can I ask the Minister, because we have had no provisional plans to deal with that eventuality, if the HSE, and it met, remember, the Mental Health Commission on the 27th of January and failed to convince them not to reduce it at that stage, if it fails again between now and Friday, what contingency plans is the Department and the Minister putting in place to provide acute psychiatric provision for the people of Wexford and Waterford?
Thanks, Laskin Crowley. Well, again, unfortunately, I won't be able to answer some of the specific questions that's been asked. As I said, I've just been asked to come down and just take the topical issue, and I know that's not it's not helpful to all of the deputies who are here. However, I will just say 1 or 2 things. I think everything, and I haven't spoken to Minister McEntee or the HSE on this, but I will make sure that everything possible will be done to make sure that those people who, if the service goes ahead that it has to be closed, that everything can be done by the HSE and by the Minister and the Department to assure that those people have a place to go to. I'm very much aware of the whole situation around mental health and services, and particularly families who are caught up in a service that may not be able to still be around after Friday, and I think that's a very huge, urgent concern which all the deputies have raised. But what will happen, I believe, is that the Minister of State has made it very clear in her answer that she will do everything possible herself to make sure that people are facilitated if the closure goes ahead. But I think we have to wait and see as well. I think there's no point in jumping the gun either. I think we have to give an opportunity to the HSE, and Deputy Howland did explain that the HSE had already met in January, and I can assure you that I didn't know that coming down here, so thanks for that information. And just to say, I agree with you all, it's a very serious matter, and anybody who has anybody suffering from mental health issues, and unfortunately what you said yourself about people being turned away in an A&E because they don't have a bed when they have a serious mental health issue, and I think we need to be able to correct those. I'm just very sorry I cannot give you more specific answers, but I will relay the messages back to the Department, to the HSE and to the Minister. I will ask the Minister to respond to you. Yeah. Unfortunately, the circumstances that happened last night were unforeseen.
Thank you. We now move to